Welcome to Trinity Chiropractic and our exercise resource online library. Today we're going to talk about the piriformis muscle and how you can help your adjustments by doing some easy at-home stretches. So you're probably wondering, what is a piriformis muscle? It is one of 6 muscles in the back of the hip that are called the lateral rotators or the external rotators of the leg. They originate from the top of your leg bone and they go into the back of your hip bone or your sacrum. Because there's 6 muscles there, the biggest one is the piriformis. The sciatic nerve goes through the piriformis or below it and then down your leg. So we often say the piriformis when we're talking about this muscle group. So you might hear that muscle, but it's referring to all of those muscles. It's helpful to get this muscle nice and loose because it will often get compressed by sitting down, especially in a car seat if it's unlevel. And for runners or people who are active in general on their feet with different sports, the muscle will tighten up and squeeze that nerve. So let's show you some easy stretches to do for that. There's 3 ways that I like to give people to do it. It's up to you to find the ones that help you the most. So the first one I'm going to show you is the sitting down version. Most people find this one the easiest, so we're going to stretch out for myself here, my left side. When you're sitting on a table like this, or a workout bench, or a chair, or a couch, keep your hips facing forward. Bring your leg into a 90-degree position to your side. As you're facing forward, you're going to draw your right shoulder to your left hip, or the opposite for the other side. And you can pull yourself in, try to keep that hip good and low. Pull yourself in, and then change your position every 5 to 10 seconds, and you can hold on to that stretch for about 30 seconds total. You should feel it on the same side that you're stretching into. You might have to reposition to get a good full stretch there. So that's a quick and easy one while you're sitting down at the office or in an area where you have limited space but you do have a chair. If you have a very firm bed, couch, or exercise table, the lying down position is also helpful. Simply, for the left side, you're going to lie on your right side or vice versa. Lie on your side, bend your hip 90 degrees, have your knee then rotate towards the floor as you're gently pulling just below your knee joint towards the floor. And again, about a 30-second, you should feel it pull around the back of the same side hip. That one's pretty accessible and easy to do, and if you have somebody around, they can gently put a little bit of pressure here as well too if you're having a hard time reaching it. Some people will strap an elastic of TheraBand or a rope or a shirt and help to assist the stretch by pulling in as well. The third one, it can be a little more difficult, but it's easy to control the stretch by your own body weight. So if you have an exercise mat, carpet, or a floor in your house, you might find this one helpful. So we call this the runner's stretch. There's other terms for it in yoga as well too. One way to stretch this is to have your trailing leg, or the one that's not affected, behind you. Some people find that a challenge because of hip mobility issues. So whether it's behind you or to the side, it's irrelevant. You're stretching the leg that's in front, and you're keeping your knee bent at 90 degrees and your hip as well. And you're trying to place it as flat on the floor as much as you can, while your trailing leg goes behind you or to the side, whatever's comfortable, and draw your shoulder, the opposite shoulder again, towards that knee, maintaining pressure. You should feel it in the back of that hip, and you can change your position across your knee, whether from your shoulder or the middle of your chest, so you're getting different parts of that muscle band that fans out. If you're doing those things, you should be able to feel it. Stretch it out gently. It shouldn't be painful. It should just get right into the area where you feel it around the back of your hip. Doing those things will help your adjustments go easier through the sacroiliac joint or the lower back. That should be done on a daily basis, 3 to 5 times a day or more if you find it more beneficial. Thank you. I hope you found this helpful.